Question 1. The CNA is caring for a client who is on precautions for methicillin-resistant Staphylococcus aureus, MRSA. Which of the following precautions should the CNA utilize? A. Respiratory precautions. B. Neutropenic precautions. C. Droplet precautions. D. Contact precautions. Correct answer. D. Contact precautions. Question 2. The CNA is caring for a client who is experiencing an infection with Clostridium difficile, C. diff. Which of the following should be used when caring for this client? A. Gloves and surgical mask. B. Gown, gloves, and N95 respirator. C. Gown and gloves. D. Gown, gloves, surgical mask and face shield. Correct answer. C. Gown and gloves. Question 3. You are working in your unit and the nurse asks you, please take this cup of medication and give it to room 5. What is your next step? A. Tell the nurse that giving medication is out of your scope of practice and report this to the nursing supervisor. B. Take the medication to room 5. C. Tell the nurse that she should give the medication herself. D. Both B and C. Correct answer. A. Tell the nurse that giving medication is out of your scope of practice and report this to the nursing supervisor. Question 4. You have a resident on day shift that is refusing a shower. He has not had a shower in 3 days. How would you respond to this resident? A. Tell him you will call his daughter if he does not agree to take a shower. B. Explain to him that it is his right to not take a shower and that you can try again tomorrow. C. Gently force him into the bathroom until he agrees to shower. D. Tell him he must take a shower so you don't get into trouble for not doing your job. Correct answer. B. Explain to him that it is his right to not take a shower and that you can try again tomorrow. Question 5. The CNA is assisting a client to shower. Which of the following should be completed prior to bringing the client into the shower? A. Apply skin lotion to the client's heels and bottoms of feet to soften calluses. B. Test the water temperature. C. Turn the water to the hottest setting. D. None of these. Correct answer. B. Test the water temperature. Question 6. The CNA is assisting a client with lower right-sided weakness to ambulate using a cane. Which of the following techniques should be used? A. Place the cane in their left hand. B. Place the cane in the client's dominant hand. C. Place the cane in their right hand. D. Hand placement isn't a factor as long as the client uses the cane. Correct answer. A. Place the cane in their left hand. Question 7. While assisting a client with bathing, the CNA notices an area of redness on the elbow of the client. The area does not turn pink when light pressure is applied. Which of the following should the CNA do next? A. Raise the area on a pillow. B. Notify the nurse. C. Apply lotion to the area. D. Lower the area to a dependent position. Correct answer. B. Notify the nurse. Question 8. The CNA is providing a back rub to a client as part of evening care. Which of the following should be included in the correct technique for this intervention? A. Heat the lotion or oil until it is not. B. Use deep, short strokes. C. Chill the lotion/oil in the freezer. D. Use a light, circular motion on skin over bony prominences. Correct answer. D. Use a light, circular motion on skin over bony prominences. Question 9. The CNA can promote autonomy and self-image of the client through which of the following interventions? A. Select the style you feel looks on the client. B. Asking the client how they would like their hair styled. C. Styling the client's hair in a manner that is quickest. D. Both A and C. Correct answer. B. Asking the client how they would like their hair styled. Question 10. You and a coworker are charting on the computer. Your coworker gets up and walks away without logging off the computer. What is this an example of? A. HIPAA violation. B. Malpractice. C. Defamation. D. Negligence. Correct answer. A. HIPAA violation. Question 11. You witnessed a patient fall and are reporting what happened to the nurse in charge. You should A. Call the patient's family to report the fall since you witnessed it. B. State facts only. C. Give your opinion on what may have caused the fall. D. Be sure to chant that the patient had a fall in the patient's chart. Correct answer. B. State facts only. Question 12. You are feeding a patient with dementia when another patient with dementia makes a sexual pass at the patient you are feeding. What is your response? A. Ask the patient that made the pass not to do it again. B. Ask the patients to only have this conversation in private and not in the dining area. C. Report it to the charge nurse because a patient with dementia L cannot give consent. D. None of these. Correct answer. C. Report it to the charge nurse because a patient with dementia L cannot give consent. Question 13. A resident that usually loves going to bingo game nights is sitting in her room, crying. She states that she does not want to go to bingo tonight. What is your response to her? A. It's okay if you don't want to go, but do you want to talk about why you don't want to go to bingo? B. Okay, you don't have to go, maybe another night. C. There are going to be lots of fun prizes you should go to. D. Why don't you want to go? All of your friends are there. Correct answer. A. It's okay if you don't want to go, but do you want to talk about why you don't want to go to bingo? Question 14. An immobile client requires transfer from a chair to their bed. Which of the following should the CNA utilize to transfer this client? A. Physical assistive 1. B. Mechanical lift. C. Gait belt. D. Contact guard assist. Correct answer. B. Mechanical lift. Question 15. The CNA is assisting a client when a red rash is noted on their groin area. What should the CNA do? A. Notify the nurse. B. Apply a moisturizing skin lotion. C. Apply a cornstarch powder. D. Ask the family what they would like applied to the rash. Correct answer. A. Notify the nurse. Question 16. The care plan for a client indicates they should be repositioned every 2 hours when in bed. Which of the following is the rationale for this nursing intervention? A. Prevent skin breakdown. B. Decrease fall risk. C. Increases client comfort. D. Provide the opportunity to check in with the client. Correct answer. A. Prevent skin breakdown. Question 17. Upon entering a room, the CNA finds a client who is not responsive. What should the CNA do next? A. Page the doctor on call. B. Call for help. C. Telephone the family contact. D. Close the curtain around the bed to maintain privacy. Correct answer. B. Call for help. Question 18. Who does the nurse aide directly report to? A. The administrator. B. The director of nursing. C. The licensed nurse. D. The CEO of the healthcare facility. Correct answer. C. The licensed nurse. Question 19. Which of the following interventions should the CNA use to promote autonomy for a client regarding sleep and rest? A. Ask the client what their preferences are for bedtimes and waking. B. Put the client to bed at the time requested by their family. C. Follow them until the sleep and wake cycle. D. None of these. Correct answer. A. Ask the client what their preferences are for bedtimes and waking. Question 20. You have a patient that has received bad news about her husband. Before reaching out to hold her hand, what should you consider? A. Whether the patient is crying or not. B. What is the patient's cultural background? C. What race the patient is. D. Whether the patient has psychological health issues. Correct answer. B. What is the patient's cultural background?